patient came in the other day and brought me in their blood work, as I ask my patients to do, whether they're here for nutrition or another condition. I like to see the blood work. And this patient was particularly concerned with her triglycerides. They were 321 milligrams per deciliter. That's twice the normal amount, if you will. It should be under 150 milligrams per deciliter. And she also had very low levels of HDL, which is the good cholesterol. When I see a patient who brings me these types of values on a blood work result, I think of other conditions that are comorbid with high triglycerides. You see, when you have high triglycerides in the blood, it's not solely high fat in the blood, but it's inflammation that occurs in other parts of the body, causing other conditions, other chronic conditions. And we see a lot of these patients have lots of different pain syndromes. So how do you lower triglycerides? Her doctor put her on a fibrate, which is a triglyceride lowering medication. But we know that omega-3 fatty acids, fish oil, decreases fat in the blood. We know that a certain type of B vitamin, niacin, which is vitamin B3, lowers triglycerides in the blood. And we also know that if you cut down on sugar, particularly high fructose corn syrup, which was almost non-existent decades ago, you will see a drop in your triglycerides. Now, why are high triglycerides a concern? Because doctors know when you have high levels or elevated levels of triglycerides, you have an increased likelihood of cardiovascular disease and stroke. It's something that every single patient should be concerned about. I always say, know your number. And if your number is high, if you change your diet, not necessarily take medication, but change your diet and improve your lifestyle, you could drop your triglycerides. So here's what I would do, or what I'm going to do with this particular patient. One, increase her fiber content between 30 and 50 grams a day. Not hard to do if you're consuming whole foods. You get on a B3 vitamin, niacin, you get on a fish oil. We have some great herbals that help control blood sugar, because if your blood sugar is high, chances are your triglycerides are high. And of course, you have to mention exercise, because nothing sucks out fat out of the blood and sugar out of the blood like good old-fashioned exercise, particularly high-intensity exercise, training, which is something that we do in the office here. So if you have high triglycerides and you go to your doctor and your medical doctor says, listen, you have high triglycerides, take this medication and you'll be okay, think of it this way. The cause of high triglycerides is not solely the medication. It's your lifestyle, it's your diet. It's not easy, but once you make that change and once you experience good health, there's nothing more in life you're going to want. As always, thanks for coming in, thanks for tuning in. Bring in your blood work. I will look at it, I will review it with you, and I'll make some recommendations that will definitely enhance the quality of your life. Thank you.